So a lot of times I have patients coming into my practice asking about tear trough filler, and very seldom is tear trough filler actually the right answer. And so I Googled pictures of a bunch of different anatomy to show you guys when tear trough filler is a good answer, whether it's skincare, lasers, etc. So we're gonna start with the first patient here. You can see here that it looks like she has very hollow under eyes, but for her, it's more of a pigmentation concern. It's that dark skin, and you can tell it's dark skin if you pull your skin down and the pigmentation comes with you. It's not necessarily hollow and needing volume. It's something where you need to treat the skin. So something like a laser resurfacing, chemical peel, and really good skincare products is what's gonna help here. With this patient, it's a texture issue. It's very crepey skin. And so that's something where I touch on this a lot when I talk about surgery. Surgery does not fix skin. It removes excess skin, but it doesn't change the texture of the skin there. So this is a perfect patient where we would want to do something to address the skin. This is laser resurfacing to help with the texture. This is microneedling with PRP, microneedling with exosomes is going to be a really great option to improve the collagen. And then using a skincare product like our AGE eye product is going to be great because that has peptides in it, or using an eye-specific retinol. Now this patient is a perfect example of where volume is going to be helpful. You can see that she is missing volume in her under eye area and even her mid-face. So she's one where doing filler or fat to her mid-face or cheek is going to help with that lower lid cheek junction, and then a very carefully precise amount of filler like hyaluronic acid or nano-fat is going to help in the tear trough region. This is a very common type of anatomy to come into the office. They come in, they say have their bags under their eyes and they want filler. So you can see the fullness that she has right here. And then this area kind of underneath where it looks like there's hollowing is not actually hollow. If you take the volume away, you're going to get the natural curvature of that lower lid cheek junction. So this is something where if you go to a not experienced injector or a non-surgical injector, they will add filler or can add filler here, and then you're just going to look puffy or like you have allergies. You'll end up in my office, we'll be reversing it, and we'll be talking about surgery. Now with this, you can do a transconjunctival approach where I go from inside the lower eyelid, there's no external cuts or scars, and I can remove or reposition that fat to make the puffiness go away. So this patient is a really good example of when Botox is going to be really valuable. So you see the kind of fullness that she has underneath, right underneath her eyelid. So that's her orbicularis muscle. And so I call it jelly roll Botox. And we put a dot of Botox right there. It can help soften some of the folding. You can also see these little crinkles here in her mid-face, and you can see when I wrinkle up here, there's a muscle right here, your name's Alice. If we put some Botox in there, that can help with the crinkling in the medial eye. And then some Botox around her eyes here are gonna help with those dynamic smile lines and wrinkles. She would also benefit from some texture resurfacing there, like a laser, microneedling, or chemical peels. So this patient is a great example of when lower lid surgery is another option. So for her, she's one where she's even getting a little bit of drooping of the lower eyelid. There's fullness underneath the eyes, and there's a little bit of skin laxity. So she's one, if she smiles, there's gonna be a lot of folding. So with her, I would do an open lower lid blepharoplasty. We would make a little incision underneath the lash line. We would remove or reposition the fat pads that are there and remove a little excess skin. And then I would also tighten her lower eyelids so they don't sit open as much, and that can really rejuvenate the eye.